Imagine child trafficking, but changing its name to child group holiday, or smoking weed, but calling it legal because pharmacists now sell it over the counter. Yeah, that's the situation in Kenya right now. I'm sure you know about female genital mutilation. But girls are still undergoing that, but in hospitals and at the hands of health workers, part of a worrying trend keeping the legal practice alive. Now, when Kenya banned FGM in 2011, few expected that the practice, traditionally performed in public with pomp and ceremony, would migrate to backroom clinics and private homes with nurses and pharmacists doing the procedure underground and calling it medicalized female genital mutilation. Now, the medicalized FGM, as it's known, is defended by practitioners and communities alike as a safe way to preserve the custom, despite risks to the victim's physical, psychological, and sexual health. Now, FGM rates fell by more than half, from 38% in 1998 to 15% in 2022. But now there is a dangerous rise in FGM with terrible complications in tandem. That said, joining us to have this conversation is Vincent Ogalo Mwita, an advocate, youth, gender, and equity in Kenya. Thank you so much, Vincent, for joining us on the show. Vincent, can you hear us? Vincent, I think your device is muted. Could you unmute your device, please? All right, while we wait for Vincent, I'll have you know that in Kenya, the female genital mutilation went on for a long time, I think between 2002 to 2022. And over time, we had young females who were affected psychologically and even had complications, with their sexual health, their physical health, psychological health. And then a lot of statistics show that it's not just in Kenya. Across the African continent, these women have diverse complications from female genital mutilations. And it is believed that some of them believe that it's done to prevent, premarital sex, so to keep themselves before they get married. And it used to be a big tradition, for some of these women. And it was a practice that for a long time, we talked about the abolition of these practices because they were unhealthy for some people. In fact, even recently in 2022, we had a report where a lady who was outside of the African continent did complain that it kind of changed her life, and not positively, because it gave her a lot of complications sexually, and even after she got married, she still had issues. So for a long time, female genital mutilation has been something that people have tried to put an end to. But then imagine now it's happening in Kenya, and then they've medicalized it in a way that they believe that having to do it in hospitals and not using primitive equipment or unsterilized equipment makes a difference. They call it medicalized because they believe that it's done, under the watchful eyes of medical expert professionals. Talk about nurses, doctors, pharmacists, and then they medicalize this process and make it look like it's still okay. And because of that, a trend that has been dying down for like the last 10 years up until 2022, we started seeing a resurgence of numbers. We start seeing young girls being mutilated, but in hospitals. And then that used to be their that was their defense. And now, some advocate groups are now calling on the government to put a stop to this, because whether it's done under a tree or it's done in the hospital, barbaric is barbaric. And these things have effect on the ladies psychologically, physically, sexually, and we've seen it over time. It's not new, right? And this also brings, the issue of gender discrimination to play, because a lot of ladies going through all of this necessarily do not need to. I mean, women already have issues that they're dealing with, so all of this is not necessary, because there's been a long time debate, where you say that why is there no practice to keep the men from premarital sex? Why is it the women who have to, suffer this ill fate because they're trying to keep themselves from marriage? And for a long time, we've narrowed this down to ignorance and lack of education, lack of awareness. But even at that, trying to cry out in the 21st century to all these women who conduct these practices, we still find out that there are a lot of women who hold strong this belief that it's worked for them over time. And it's difficult getting to convince these people because they went under the knife, so to speak, themselves. So they will not believe that it doesn't work because they went through it, it worked for them in their days, and so they would want to do it to their children and their grandchildren. And that's why it's very difficult to get through to these people in these areas. And we do not just see it in primitive societies these days. We're not just seeing it in, some remote villages and some places that, some rural places that education or information has not reached. We're now seeing it in the major cities, in the major towns, because it's infiltrating deeply into the society. Imagine medicalizing a process that should be abolished for years. And so we're asking, what exactly is the government doing about it? Because now it's not up to individuals alone. It's not up to advocacy groups or, people who are against it, to call for action. It's now left for the government to make these people aware and to also, get them to stop this practice. But anyways, I think we have our guest back with us, so I'm just going to give it another try. Vincent Ogalo Mwita. Vincent, please, can you confirm you can hear us?
Thank you so much. Sorry for the technicalities, but I can hear you now. I can hear you. Thank you.
It's a relief. Thanks for joining us. All right, Vincent, let's go straight to the conversation because I've basically talked extensively about female genital mutilation and how it has been modernized and called, medicalized female genital mutilation. What exactly are the driving factors behind the resurgence of FGM, especially in Kenya? How exactly did we resurrect an act that has been dying down for the last decade?
Thank you so much, and thank you for the elaborate conversation and also just taking the viewers through in depth of medicalization and issues around FGM. But as we all know, like you said, Kenya is among the countries that have made progress in terms of ensuring that we are banning and abolishing the female genital mutilation. It's not just female genital mutilation, but any form of female genital mutilation, inclusive of the medicalized one. And basically, this one we did in Kenya by introducing a law, a policy, the Prohibition of Female Genital Mutilation Act of 2011 that criminalizes or abolished any form of any form of female genital mutilation, be it in which way, and all the types from type 1 to the last type 4 of female genital mutilation. And coming back to your question about the things that are facilitating this, we get that in Kenya, I must say that FGM is being practiced in a number of communities, and we are structured into counties. So right now, FGM we have 47 counties in Kenya, but among the 22 counties are really put as hotspots whereby communities within those counties out of 47, 22 are practicing FGM. And it is different because we know that as communities practice FGM, there has been also an emerging trends, things that are coming out. And this is one way of doing FGM, but again, moving or running away from the repercussion or maybe hiding. And medicalized FGM has been one of the issues that Kenya is really struggling with when it comes to putting efforts in terms of eradication of female genital mutilation. And you get that as much as it's abolished and these are emerging trends, you get that children children are really being subjected to this at early age during the birth, and some cases have been reported even when these children are being taken to seek for medical attention, especially to the health facilities in Kenya. And basically, there are communities in Kenya that are really notorious in terms of medicalization. As much as the Kenya Demographic Health Survey, that statistic that Kenya just did recently in 2022 last year, as much as Kenya has made progress in terms of, we've come from national prevalence of to 40 to actually 15%, 14%. There are still medicalized that are still being done, and Kisii County is among the leading counties within the 47 counties in Kenya that this practice is being done. And you get that this medicalized FGM are really thing that is happening. And I can say that there are health practitioners who have taken oath of executing their medical practice in terms of ensuring that they give the best to the citizens and the patients. But again, you get that other patients are colluding, or other families, other people are colluding with these medical practitioners to ensure that children are cut, girls are cut in the hospitals, and to some extent you can get that even these health practitioners are being invited by community members to their homes.
All right,
Vincent.
It
is being done really sick.
All right, Vincent, thank you. Apologies, but this is the much we can take on this show. I would really have loved for us to continue this conversation. But once again, thank you for joining us to discuss the medicalized female genital mutilation. And we do hope that the government does something about it and there is awareness spread through to these areas where it's still being practiced and it's very prevalent. Thank you once again, Vincent Ogalo Mwita, advocate, youth, gender and equity in Kenya. Thanks for joining us.
Thank you so much for hosting me. Thank you.